Section 11. Substance Abuse. 1. Psychoactive substances have been used to induce changes in which of the following? A. Perception. B. Cognition. C. Behavior. D. All of the above. The correct answer is D. All of the above. 2. Which of the following is a commonly abused substance? A. Alcohol. B. Amphetamine. C. Opioids. D. All of the above. The correct answer is D. All of the above. 3. Blank is the most dangerous form of substance abuse. A. Drug mixing. B. Cocaine. C. Marijuana. D. Hallucinogens. The correct answer is A. Drug mixing. 4. Which of the following is a consequence of substance abuse? A. Financial problems. B. Low intelligence. C. Physical dependence. D. All of the above. The correct answer is D. All of the above. 5. Blank is the repeated use of psychoactive drugs that doesn't lead to compulsive use. A. Addiction. B. Substance abuse. C. Substance dependence. D. Drug dependence. The correct answer is B. Substance abuse. 6. Blank refers to the persistent use of alcohol or other psychoactive drugs that leads to withdrawal symptoms when the drug use is decreased. A. Substance abuse. B. Addiction. C. Substance dependence. D. All of the above. The correct answer is C. Substance dependence. 7. A condition called blank may occur if the drug was adulterated with an inert substance. A. Talc granulomatosis. B. Talcum granulosis. C. Viral hepatitis. D. Bacterial infection. The correct answer is A. Talc granulomatosis. 8. Using contaminated needles may lead to which of the following? A. Respiratory infections. B. Viral hepatitis. C. Musculoskeletal dysfunction. D. Gangrene. The correct answer is B. Viral hepatitis. 9. Chronic 4 drug abuse can lead to which of the following? A. Psychosis. B. Septicemia. C. Vasculitis. D. All of the above. D. All of the above. 10. In 2001, about blank of the general population abused alcohol or illicit drugs in the United States. A. 7%. B. 17%. C. 20%. D. 30%. A. 7%. 11. Which of the following is the most abused substance? A. Marijuana. B. Cocaine. C. Alcohol. D. Crack. The correct answer is C. Alcohol. 12. Among illicit drugs, blank ranks first in use. A. Cocaine. B. Heroin. C. Marijuana. D. Morphine. The correct answer is C. Marijuana. 13. Blank is used by approximately 76% of illicit drug users. A. Morphine. B. Marijuana. C. Heroin. D. Alcohol. The correct answer is B. Marijuana. 14. Blank is the decreased response to a drug that comes with repeated use. A. Tolerance. B. Addiction. C. Substance abuse. D. Substance dependence. The correct answer is A. Tolerance. 15. Blank is an adaptive state that occurs as a normal physiologic response to repeated drug use. A. Drug addiction. B. Substance abuse. C. Physical dependence. D. Tolerance. The correct answer is C. Physical dependence. 16. Which of the following is an uncomfortable syndrome that occurs when tissue and blood level of the abused substance decrease in a person who has used that substance heavily over a prolonged period? A. Withdrawal. B. Tolerance. C. Dependence. D. Intoxication. The correct answer is A. Withdrawal. 17. Blank is a reversible substance-specific syndrome caused by injection of or exposure to that substance. A. Tolerance. B. Intoxication. C. Withdrawal. D. Dependence. The correct answer is B. Intoxication. 18. Blank have been linked to susceptibility to alcohol dependence. A. Chromosomes 1 and 7. B. Chromosomes 1 and 2. C. Chromosomes 7 and 3. D. Chromosomes 5 and 6. The correct answer is A. Chromosomes 1 and 7. 19. Some scientists suspect that drug addicts have an inborn deficiency of blank. A. Serotonin. B. Vasopressin. C. Endorphin. D. Chromosome 7 and 3. The correct answer is C. Endorphin. 20. According to blank theory, enzymes produced by a given gene might influence hormones and neurotransmitters, which can lead to a personality that is more sensitive to peer pressure. A. Psychobiological theories. B. Neurobiological theory. C. Genetics theory. D. Behavioral theory. The correct answer is C. Genetics theory. 21. Blank views drug abuse as the result of a conditioning or cumulative reinforcement from the drug use. A. Neurobiological theory. B. Genetics theory. C. Behavioral theory. D. Psychobiological theory. The correct answer is C. Behavioral theory. 22. According to blank, drug use serves as a biological reward. A. Biological theory. B. Behavioral theory. C. Social theory. D. Psychological theory. The correct answer is B. Behavioral theory. 23. Blank can trigger drug craving that can lead to relapse. A. Withdrawal. B. Tolerance. C. Environment. D. All of the above. The correct answer is C. Environment. 24. According to blank, young adults take drugs to preserve childhood and avoid having to deal with adult conflicts and responsibilities. A. Social theory. B. Behavioral theory. C. Neurobiological theory. D. Genetics theory. The correct answer is A. Social theory. 25. Which of the following fits a profile of a drug abuser? A. He is excessively dependent on others. B. He has low self-esteem. C. Low tolerance for frustration. D. All of the above. The correct answer is D. All of the above. 26. Which of the following is a characteristic of a typical drug abuser? A. He is usually depressed. B. He is usually anxious. C. He often gets angry. D. All of the above. The correct answer is D. All of the above. 27. Which of the following is a depressant that reduces the activity of neurons in the brain? A. Amphetamine. B. Caffeine. C. Alcohol. D. All of the above. The correct answer is C. Alcohol. 28. Alcohol dependence is characterized by all of the following symptoms except A. Biological adaptation, B. Physical adaptation, C. Maladaptive consequences, D. Loss of control. The correct answer is B. Physical adaptation. 29. Which of the following is true about alcohol abuse? A. About 13% of U.S. residents suffer from alcohol abuse. B. It starts as early as elementary school. C. Nearly 20% of adolescents aged 12 to 17 have serious drinking problems. D. All of the above. The correct answer is D. All of the above. 30. Alcohol abuse decreases the lifespan by roughly blank. A. 2 years. B. 7 years. C. 15 years. D. 30 years. The correct answer is C. 15 years. 31. Alcohol intoxication can be fatal if the blood level exceeds blank. A. 100 milligrams/dl. B. 200 milligrams/dl. C. 300 milligrams/dl. D. 400 milligrams/dl. The correct answer is D. 400 milligrams/dl. 32. Which of the following is a psychiatric complication of alcohol abuse? A. Suicide. B. Prostatitis. C. Hypoglycemia. D. Cirrhosis. The correct answer is A. Suicide. 33. All of the following are cardiopulmonary complications of alcohol abuse except A. Pneumonia. B. Increased risk of tuberculosis. C. Depression. D. Essential hypertension. The correct answer is C. Depression. 34. Blank causes restlessness, pacing, and an inability to rest or sit still. A. Dystonia. B. Akathisia. C. Bradykinesia. D. Alcoholic dementia. The correct answer is B. Akathisia. 35. Which of the following can be consumed by an alcoholic if he can't find any source of alcohol? A. Mouthwash. B. Aftershave. C. Hairspray. D. All of the above. The correct answer is D. All of the above. 36. Withdrawal symptoms begin shortly after drinking stops and lasts up to blank. A. 10 days. B. 20 days. C. 30 days. D. 45 days. The correct answer is A. 10 days. 37. Blank is marked by acute distress brought on by drinking cessation in a person who's physically dependent on alcohol. A. Withdrawal delirium. B. Delirium seizure. C. Motor seizure. D. Tremor seizure. The correct answer is A. Withdrawal delirium. 38. In a patient with severe liver diseases, which of the following is true? A. Blood urea nitrogen level drops. B. Serum glucose level drops. C. Low plasma ammonia level. D. All of the above. The correct answer is B. Serum glucose level drops. 39. Blank is a sign of mild withdrawal symptoms. A. Pulse 120 to 140 beats per minute. B. Nausea. C. Vomiting. D. All of the above. The correct answer is B. Nausea. 40. Which of the following is a sign of severe alcohol withdrawal? A. Marked hyperhidrosis. B. Nausea. C. Tachycardia. D. Impaired appetite. The correct answer is A. Marked hyperhidrosis. 41. In managing acute withdrawal, diazepam can be used to blank. A. Ease overhydration. B. Reduce CNS irritability. C. Ease withdrawal symptoms. D. Sedate. C. Ease withdrawal symptoms. 42. Blank can be used to deter alcohol use. A. Phenobarbital. B. Disulfiram. C. Thiamine. D. Furosemide. The correct answer is B. Disulfiram. 43. Which of the following may reduce alcohol craving and help prevent an alcoholic from relapsing? A. Naltrexone. B. Phenobarbital. C. Furosemide. D. Antipsychotics. The correct answer is A. Naltrexone. 44. Usually, naltrexone therapy lasts at least blank. A. 2 weeks. B. 7 weeks. C. 10 weeks. D. 12 weeks. The correct answer is D. 12 weeks. 45. For long-term abstinence, which of the following is more effective? A. Rehabilitation. B. Use of emetic agents. C. Antagonist therapy. D. Aversion therapy. The correct answer is A. Rehabilitation. 46. Which of the following is an appropriate nursing intervention during drug withdrawal? A. Refer the patient for rehabilitation as appropriate. B. Institute seizure precautions. C. Maintain a quiet and safe environment. D. All of the above. The correct answer is C. Maintain a quiet and safe environment. 47. Amphetamine can be used medically to treat which of the following? A. Liver cirrhosis. B. Prostatitis. C. Obesity. D. Suicide. The correct answer is C. Obesity. 48. Which of the following is in the group of amphetamines? A. Methamphetamine. B. Amphetamine sulfate. C. Dextroamphetamine. D. All of the above. The correct answer is D. All of the above. 49. On the streets, amphetamine sulfates are called which of the following? A. Crank. B. Bennies. C. Crystal. D. Meth. The correct answer is B. Bennies. 50. Which of the following is also known as speed on the streets? A. Dextroamphetamine. B. Amphetamine. C. Methamphetamine. D. Grannies. The correct answer is C. Methamphetamine. 51. Dextroamphetamine sulfates may be referred to as blank. A. Dexies. B. Hearts. C. Oranges. D. All of the above. The correct answer is D. All of the above. 52. The rush experienced from amphetamine is probably a result of blank. A. High level of dopamine. B. Low level of serotonin. C. Increased release of serotonin. D. Low level of dopamine. The correct answer is A. High level of dopamine. 53. Which of the following is a symptom of a patient under the influence of amphetamines? A. Euphoria. B. Diaphoresis. C. Seizures. D. All of the above. The correct answer is D. All of the above. 54. Severe methamphetamine intoxication may cause which of the following? A. Beriberi. B. Fatty liver. C. Stroke. D. Cirrhosis. The correct answer is C. Stroke. 55. All of the following are amphetamine withdrawal symptoms except A. Violent behavior. B. Disorientation. C. Nausea. D. Abdominal tenderness. The correct answer is C. Nausea. 56. Which of the following treatment is commonly used to treat methamphetamine? A. Antidepressant. B. Cognitive behavioral therapy. C. Social therapy. D. Relaxation therapy. The correct answer is B. Cognitive behavioral therapy. 57. Caffeine intoxication can occur with consumption of more than blank of caffeine. A. 200 milligrams. B. 150 milligrams. C. 300 milligrams. D. 250 milligrams. The correct answer is D. 250 milligrams. 58. Which of the following are dietary sources of caffeine? A. Tea. B. Chocolate. C. Coffee. D. All of the above. The correct answer is D. All of the above. 59. Which of the following is a sign of caffeine intoxication? A. Arrhythmias. B. Facial flushing. C. Insomnia. D. All of the above. The correct answer is D. All of the above. 60. All of the following are withdrawal symptoms of caffeine except A. Headache. B. Aggression. C. Nausea. D. Fatigue. The correct answer is B. Aggression. 61. Which of the following is a common street name for cannabis? A. Pot. B. Jellies. C. Grannies. D. Heart. The correct answer is A. Pot. 62. The maximum duration of action for cannabis is blank. A. 12 hours. B. 24 hours. C. 6 hours. D. 2 hours. The correct answer is A. 12 hours. 63. Which of the following is true about marijuana? A. Male users outnumber female users. B. It is the most commonly used drug among juvenile arrestees. C. 37% of people aged 12 and above have tried marijuana at least once. D. All of the above. The correct answer is D. All of the above. 64. Which of the following is an effect of cannabis intoxication? A. Lung disease. B. Decreased testosterone. C. Weak immune system. D. All of the above. The correct answer is D. All of the above. 65. All of the following are dysphoric effects of cannabis intoxication except A. Paranoia. B. Depersonalization. C. Drowsiness and sluggishness. D. Psychotic episodes. The correct answer is C. Drowsiness and sluggishness. 66. Blank is a powerful addictive narcotic and stimulant. A. Caffeine. B. Alcohol. C. Cocaine. D. Amphetamine. The correct answer is C. Cocaine. 67. Blank is a fine white crystallized powder. A. Cocaine hydrochloride. B. Crack. C. Sodium bicarbonate. D. Hemp. The correct answer is A. Cocaine hydrochloride. 68. Effects of cocaine hydrochloride last up to blank. A. 4 hours. B. 2 hours. C. 6 hours. D. 12 hours. The correct answer is B. 2 hours. 69. Which of the following is a street name for cocaine? A. Queen. B. Snow. C. Cane. D. Sugar. The correct answer is B. Snow. 70. Cocaine can be used for which of the following legitimate medical reasons? A. As a local anesthetic for hand bleeding. B. For depression. C. As a local anesthetic for nasal surgeries. D. To stop leg bleeding. The correct answer is C. As a local anesthetic for nasal surgeries. 71. Which of the following is true about cocaine? A. It is the most widely used illicit drugs in the United States. B. About 10% of U.S. residents over age 12 have tried cocaine at least once. C. Men and women use it equally. D. All of the above. The correct answer is B. About 10% of U.S. residents over age 12 have tried cocaine at least once. 72. Taking the drug repeatedly and at increasingly high doses is known as blank. A. Cocaine binge. B. Cocaine addiction. C. Cocaine dependence. D. All of the above. The correct answer is A. Cocaine binge. 73. Which of the following are health hazards associated with the use of cocaine? A. Stroke. B. Seizures. C. Respiratory failure. D. All of the above. The correct answer is D. All of the above. 74. In a patient under the influence of cocaine, general assessment findings may include which of the following? A. Euphoria. B. Vertigo. C. Grandiosity. D. All of the above. The correct answer is D. All of the above. 75. Propranolol is typically given for blank. A. Vomiting and nausea. B. Seizures. C. Tachycardia. D. None of the above. The correct answer is C. Tachycardia. 76. Hallucinogens are sometimes called blank. A. Narcotics drugs. B. Psychedelic drugs. C. Stimulants. D. Depressants. The correct answer is B. Psychedelic drugs. 77. The most potent mood and perception-altering drug known is blank. A. Lysergic acid diethylamide. B. Ecstasy. C. Ketamine. D. Psilocybin. The correct answer is A. Lysergic acid diethylamide. 78. Green is a street name belonging to which of the following drugs? A. Ecstasy. B. Mescaline. C. Lysergic acid diethylamide. D. Ketamine. The correct answer is C. Lysergic acid diethylamide. 79. Lysergic acid diethylamide produced in crystalline form can be crushed to powder and mixed with binging agents to produce tablets known as blank. A. Window panes. B. Microdots. C. LSD tablets. D. Blotter tablets. The correct answer is B. Microdots. 80. Oral doses of lysergic acid diethylamide as small as 30 micrograms can produce effects that last up to blank. A. 12 hours. B. 16 hours. C. 18 hours. D. 24 hours. The correct answer is A. 12 hours. 81. Which of the following is true about lysergic acid diethylamide? A. It is 100 times more potent than psilocybin. B. It is 4,000 times more potent than mescaline. C. It has a dramatic effect on the senses. D. All of the above. The correct answer is D. All of the above. 82. Ecstasy is also known as blank. A. 4-methylene dioxymethamphetamine. B. Essence. C. Atom. D. All of the above. The correct answer is D. All of the above. 83. Which of the following drugs is tasteless and odorless? A. Ecstasy. B. Ketamine. C. Dextromethorphan. D. 4-methylene dioxymethamphetamine. B. Ketamine. 84. Which of the following is a street name for ketamine? A. Special K. B. Vitamin K. C. Green. D. All of the above. The correct answer is D. All of the above. 85. Which of the following is found in some OTC cold and cough medications? A. Dextromethorphan. B. Ketamine. C. Ecstasy. D. Psilocybin. The correct answer is A. Dextromethorphan. 86. Which of the following is increasingly used as a club drug? A. Ketamine. B. Psilocybin. C. Dextromethorphan. D. All of the above. The correct answer is A. Ketamine. 87. Which of the following is found in cactus plants? A. Psilocybin. B. Mescaline. C. Ketamine. D. Date rape. The correct answer is B. Mescaline. 88. Which of the following is true about hallucinogens? A. It is less common than cocaine. B. Overall use by secondary school students has declined since 1998. C. Fewer than 5% of people in the United States have tried any hallucinogenic drug. D. All of the above. The correct answer is D. All of the above. 89. Which of the following is a health hazard of hallucinogens? A. Respiratory depression. B. Seizures. C. Heart failure. D. All of the above. The correct answer is D. All of the above. 90. All of the following causes compulsive drug-seeking behavior except A. Heroin. B. Cocaine. C. Lysergic acid diethylamide. D. Alcohol. The correct answer is C. Lysergic acid diethylamide. 91. Blank is characterized by terrifying thoughts and nightmarish feelings of anxiety and despair. A. Bad trips. B. Mood swings. C. Mania attack. D. None of the above. The correct answer is A. Bad trips. 92. Which of the following drugs show up on a standard toxicologic screen? A. Ecstasy. B. Ketamine. C. Date rape. D. Psilocybin. The correct answer is A. Ecstasy. 93. Inhalant abuse is commonly known as blank. A. Snuffing. B. Inhaling. C. Huffing. D. Tripping. C. Huffing. 94. All of the following are street names for inhalants except A. Hardware. B. Kick. C. Lick. D. Rush. The correct answer is C. Lick. 95. All of the following are types of inhalant except A. Aerosols. B. Bicarbonates. C. Nitrites. D. Gases. The correct answer is B. Bicarbonates. 96. Nail polish is an example of a blank type of inhalant. A. Volatile solvents. B. Gases. C. Aerosols. D. Nitrites. The correct answer is A. Volatile solvents. 97. The most commonly abused gas nitrous oxide is found in blank. A. Cooking sprays. B. Whipped cream dispensers. C. Room deodorizers. D. Paint. The correct answer is B. Whipped cream dispensers. 98. Which of the following is taken mainly to enhance sexual experience? A. Amyl nitrite. B. Butyl nitrite. C. Cyclohexyl nitrite. D. All of the above. The correct answer is D. All of the above. 99. Long-term inhalant abuse may lead to which of the following? A. Weight loss. B. Depression. C. Muscle weakness. D. All of the above. The correct answer is D. All of the above. 100. Blank is the most prevalent form of nicotine dependence. A. Cigarette smoking. B. Chewing tobacco. C. Pipe smoking. D. Cigar smoking. The correct answer is A. Cigarette smoking. 101. By inhaling smoke, the average smoker takes in blank of nicotine with each cigarette. A. 2 milligrams. B. 5 milligrams. C. 10 milligrams. D. 20 milligrams. The correct answer is A. 2 milligrams. 102. Which of the following is true about cigarette smoking? A. Smoking has increased dramatically over the years. B. 50% of teenage boys smoke. C. Less than 7% of people who try to quit on their own stay abstinent for more than a year. D. 40% of teenage girls smoke. The correct answer is C. Less than 7% of people who try to quit on their own stay abstinent for more than a year. 103. Within blank of inhalation of the cigarette, the nicotine levels peak. A. 20 seconds. B. 10 seconds. C. 50 seconds. D. 60 seconds. The correct answer is B. 10 seconds. 104. Nicotine stimulates the hypothalamic corticotropin releasing factor and blank. A. Decreases levels of endorphins. B. Increases pharmacokinetic properties. C. Increases levels of endorphins. D. Decreases level of vasopressin. The correct answer is C. Increases levels of endorphins. 105. Tobacco abuse is associated with which of the following cancers? A. Mouth. B. Larynx. C. Cervix. D. All of the above. The correct answer is D. All of the above. 106. Smoking accounts for nearly blank of deaths from heart disease. A. 1%. B. 20%. C. 50%. D. 100%. The correct answer is B. 20%. 107. Which of the following is true? A. Exposure to tobacco smoking in a home increases the severity of asthma. B. Cigarette smoking is linked to nearly 90% of all lung cancers. C. Secondhand smoke causes approximately 3,000 lung cancer deaths yearly. D. All of the above. The correct answer is D. All of the above. 108. Which of the following mimic nicotine's effect? A. Clonidine. B. Bupropion. C. Mecamylamine. D. Naltrexone. The correct answer is A. Clonidine. 109. Which of the following is an example of opioids? A. Morphine. B. Fentanyl. C. Methadone. D. All of the above. The correct answer is D. All of the above. 110. All of the following are effects of opioids except A. Euphoria. B. Depression. C. Sedation. D. Sleep. The correct answer is C. Sedation. 111. Which of the following is a symptom of opioid use? A. Sweating. B. Hypotension. C. Slurred speech. D. All of the above. The correct answer is D. All of the above. 112. Which of the following is an opioid antagonist used to reverse the effects of opioids? A. Naloxone. B. Methadone. C. Levorphanol. C. Meperidine. The correct answer is A. Naloxone. 113. Which of the following is the most commonly used opioid agonist in opioid detoxification? A. Meperidine. B. Methadone. C. Naloxone. D. Levorphanol. The correct answer is B. Methadone. 114. Blank is based on the concept that all symptoms arise from underlying unconscious psychological conflicts. A. Cognitive therapy. B. Behavioral therapy. C. Dynamic psychotherapy. D. Group therapy. The correct answer is C. Dynamic psychotherapy. 115. Phencyclidine is also known as blank on the streets. A. Bags. B. Ozone. C. Heart. D. Snow White. The correct answer is B. Ozone. 116. Phencyclidine produces its effect by blank. A. Reducing the GABA levels in the brain. B. Reducing serotonin levels in the brain. C. Lowering the glutamate levels in the brain. D. Increasing the glutamate levels in the brain. The correct answer is C. Lowering the glutamate levels in the brain. 117. Phencyclidine can lead to blank, which is a breakdown of muscle fibers with leakage of potentially toxic cellular contents into the systematic circulation. A. Rhabdomyolysis. B. Metabolic acidosis. C. Intravascular coagulation. D. Acute renal failure. The correct answer is A. Rhabdomyolysis. 118. Which of the following is a symptom of phencyclidine use? A. Amnesia. B. Nystagmus. C. Euphoria. D. All of the above. The correct answer is D. All of the above. 119. Which of the following is an acetylcholinesterase inhibitor that enhances acetylcholine's effect? A. Haloperidol. B. Risperidone. C. Physostigmine. D. All of the above. The correct answer is C. Physostigmine. 120. Which of the following is true about benzodiazepines? A. It acts as hypnotics in high doses. B. It acts as anxiolytics in moderate doses. C. It acts as sedatives in low doses. D. All of the above. The correct answer is D. All of the above. 121. Benzodiazepines can be used for which of the following reasons? A. To get intoxicated. B. As a substitute for cocaine. C. To enhance the effects of cocaine. D. All of the above. The correct answer is A. To get intoxicated. 122. Which of the following is a type of benzodiazepine? A. Clorazepate. B. Diazepam. C. Triazolam. D. All of the above. The correct answer is D. All of the above. 123. A patient under the influence of benzodiazepine may exhibit which of the following signs? A. Slurred speech. B. Hyperactiveness. C. Aggression. D. Increased alertness. The correct answer is A. Slurred speech. 124. Blank is the only specific benzodiazepine antidote. A. Valproate. B. Carbamazepine. C. Flumazenil. D. Clonazepam. The correct answer is C. Flumazenil.